Assalamualaikum warahmatullahi wabarakatuh. My name is Merita Arini from Universitas Muhammadiyah Yogyakarta. I'm honored to present our research with the title Integrating Virtual Reality Technology for Improving Aisyiyah Health Cadres Capacities in Fire Disaster Preparedness. The study is collaboration between Universitas Muhammadiyah Yogyakarta and Health Council of Aisyiyah National Board. As the background, fire remains one of the most frequent disasters in Indonesia. According to the National Police Command Center, from January to early October 2024, there were 1,935 reported fire incidents. Over 700 of them occurred in residential areas. Despite this, community preparedness is still lacking, especially among vulnerable groups in low resources areas. Health cadres from Aisyiyah are ideally positioned to assist during emergencies. However, their training in fire preparedness is still limited, and conventional methods such as real-world simulation are expensive and often not practical enough. Hence, this community empowerment aims to improve the capacity of IC health cadres in fire disaster by integrating virtual reality technology for efficient simulation. We implemented an educational intervention combining three methods. The first is interactive lecture on fire disaster preparedness principles, basic first aid practice, and a virtual reality simulation focused specially on how to properly use a fire extinguisher during an emergency. Participants were 35 ICCS health cadres from Kulon Progo, rural areas. We applied a pre and post-test approach to assess the intervention's impact on knowledge and confidence. Participants were mostly women aged between 36 to 60, with various educational backgrounds and active roles in their communities. As shown in the graph, there was a notable increase in knowledge scores from pre to post intervention. This suggests that our blended method, particularly the integration of virtual reality for practical skills, effectively supported learning and retention. We conducted a paired mean difference analysis to assess the impact of the intervention. The results showed a statistically significant increased knowledge with P less than 0.05, particularly in understanding fire response steps, first aid, and APAR use. Participants also reported feeling more confidence after going through the immersive virtual reality experience and hands-on first aid practice, suggesting both cognitive and affective improvement. Our findings support previous studies showing that disaster education through simulation, particularly using virtual tools, significantly improves knowledge and emergency response skills. The use of virtual reality in this study, focusing on fire extinguisher handling, aligns previous study, who emphasized the effectiveness of immersive technology in enhancing practical competencies in disaster scenarios efficiently. To conclude, our study shows that integrating virtual reality into community disaster training, when combined with interactive lectures and hands-on first aid, can significantly enhance fire preparedness among health cadres in context of knowledge. We recommend broader application of such blended models in community disaster education, especially for grassroots volunteers like the Aisyiyah health cadres. We would like to express our sincere gratitude to the Regional Board of Aisyiyah Kulon Progo, the Central Board of Aisyiyah, the Directorate of Research and Community Empowerment, and Universitas Muhammadiyah Yogyakarta for their invaluable support in this study. Thank you very much for your attention. We welcome any question and look forward to future collaboration. Wassalamualaikum warahmatullahi wabarakatuh.